Welcome to this training. Today we'll be looking at HCM 315. We'll be working on pharmacology and physiology. My name is Pharmacist Innocent Ekeleme, and I need you to be very attentive as we go through this training. So we'll be looking at pharmacology and we'll be looking at physiology together. So first of all, we'll look at the definition. What is the definition of pharmacology? And what's the definition of physiology? Just a minute, to put it on slideshow. What's the meaning of pharmacology? What's the meaning of physiology? Okay, so please, I hope the students can see my screen. Okay, so physiology is a biological science which talks about the human body. Okay, so from two words, physio, which means physical, and logy, which means study. So physiology talks basically about the human body. Then pharmacology is a science that discusses about the drug products and also the science of it. So in this course, we are going to learn the basic principle of pharmacology. We are going to learn the basic principle of physiology. We are also going to learn the autonomic and neuromuscular pharmacology. And we will learn cardiovascular pharmacology. There is another aspect of pharmacology called renal pharmacology. Then also after the renal pharmacology, we also going to learn about the central nervous system. Okay, so just a minute, let me get to the first slide. Okay, so in pharmacology, we talk about drug and how drug work on the human body. You know, for each drug, every drug a doctor or a pharmacist or a nurse gives, there is also a therapeutic target. There is something that we want to achieve for each drug that is given. So the first part of this course, we talks about the basic principle of pharmacology and physiology. We are going to look at the definition, drug disposition. In drug disposition, we have the administration of drugs, we have the absorption of drugs, we have the distribution of drugs, we have drug metabolism, that breaking down of drug, we have the excretion of drug, and also we have the effect of drug on the body. For every drug that is given to the human body, there is an effect. There is what we call the therapeutic effect. That means achieving the objective for which the drug is given. Then there is what we call adverse reaction to the drug. There are times we see other effects that we did not plan when we are given the drug. And you're going to look at the variation in the response to drug therapy, how different people respond to the same drug. So if let's take paracetamol as an example, different people can respond differently to paracetamol. Then we look at target for drug. So physiology, as we mentioned earlier on, is the scientific study of functions and mechanisms in a living system. It's a sub-discipline of biology, so it focuses on how organisms and organs and systems and individual organs and cells in the body, how do they carry out the chemical and the physical function in a living system. Whereas pharmacology is the science of drugs and their effect on biological system. We say physiology is the study of biological system, whereas pharmacology is the study of drug on that system. We all know what a drug is. It can be defined as a chemical that can cause a change in a biological system. So you have a biological system. When you introduce a drug, it can cause a change. It can cause some systems to work faster. It can cause some systems to go slower. And one important thing when you are given a drug is that you must realize that the human biological system, okay, the human body is a biological system. You must have that in your mind. Now, there are different types of formulation of drug. We have the tablet, we have the capsule, and we have the other delivery system. So pharmacology as a science encompasses the following. It encompasses the action of natural chemicals in the body. So when you give that drug that is a chemical, what is the action of that chemical in the body? It also looks at the origin and the sources of drugs. It looks at their chemical structure and their physical structure. It looks at their metabolism and their excretion. Metabolism means the breaking down of the drug. Excretion means the removal of that drug component, the metabolite from the biological system. It also studies the whole animal, the impact of drug on the whole body. It also looks at isolated organs. So it can look at the impact of the drug in the heart or the respiratory organ. It can look at the impact of the drug on tissues, on cell, on enzyme. Again, it can go a little bit more specific to looking at the impact of the drug on the DNA component. So we've already mentioned that pharmacology is the study of the toxic effect of drugs and chemical in the environment. So another level of pharmacology is to look at what is the impact of a drug in the environment beyond the human body. How does this drug impact our environment? So as a healthcare professional, what's the relationship between pharmacology and a healthcare professional? You know that in the clinical setting, most of the action that doctors take or pharmacists take are with drugs. So it's important that all members of the healthcare professional, the physiotherapists, the healthcare management people, the radiographers, you know, everybody that encounter patients daily, the doctors, the pharmacists, should at least have an idea of what pharmacology is all about. So when we give a patient a drug, one important thing is we expect the drug to have an impact on the patient. So when we give a patient a drug, we also expect the patient to comply, because for any drug you give to any patient, if the patient doesn't comply, then the drug doesn't make sense. Because whatever you want to achieve will be achieved with the patient complying to whatever you tell him or her to do about the drug. So we want to look at drug names. Every drug you see today have 3 names, okay? Every drug you see today have 3 names. There is the chemical name of the drug, there is the generic name of the drug, and there is the proprietary name of the drug. So we are going to look at an example. The paracetamol you and I have used before, you know, this is the complex chemical structure of paracetamol. The chemical name of paracetamol is N-acetyl para-aminophenol. That is the name, chemical name. The generic name is acetaminophen. So any company that manufacture it can call any name they want. So GSK manufacture and call Panadol. Emzor manufacture and call Enzo paracetamol. So let's look at drug disposition. If any drug is to have an impact on the body, then it must reach its site of action. You know, when you give a drug, when you want to take a drug, you swallow the tablet in your mouth. But maybe the place you want to treat is a boil in your toes. So for that drug to be effective, it must go to the toes. It must diffuse to that point. If it's stopped in the mouth, then it's useless. So Drug disposition talks about how the drugs move from the mouth to the organs of the body to the place you want it to reach. So in order for drug to have effect, as we mentioned, it must be properly disposed in the system, except the route of action is directly on the bloodstream. You know, sometimes the drug is injected straight on the bloodstream, but some other times you take it in the mouth, it moves around, is distributed to different part of the body, it goes to the GI, it goes to the liver, is broken down, then it goes to the other part. So that's what we are going to look at in the next level of discussion. So this is drug disposition. These are the different aspects on drug disposition. This is when we are given a drug. You can give a drug topically. Topically means at the point. You can give a drug here. We know about ear drug. It can also be by inhalation. Maybe nasal decongestant. They give it through inhalation. Topical, you can give it through the eye drops. Nasal, there can be topical or nasal. Inhalation, you know, there is topical nasal, there is inhalational. Inhalational is like drugs like salbutamol, Ventolin. When people have asthma, they inhale it. Okay. Topical, drugs like nasal decongestant. Okay. Diphenhydramine, you just drop it in the nose. Okay. Drug can also be given through oral. You can swallow it. It can be sublingual. You put it under the tongue. You put it under the tongue and close your mouth. Then it will be diluting, dissolving, and entering the bloodstream. Again, it can also be buccal. It can be at the mouth side. Drugs can be given by intravenous injection. It can be given on the skin. Maybe when you have an eczema, people have eczema and all those things, or when there is fire burnt on the skin. It can also be given rectal through the anus. It can be given through the vagina, especially drugs like diflucan for vaginal candidiasis, infection of the vagina. Again, it can be given subcutaneous. It can be given intramuscular. Subcutaneous means, you know, you put it under the skin, you know, inside the fat tissue of the skin. It can be given intramuscular injection. It can also be intrathecal. So these are the different sites of drug administration. And it's important you take note of this drug administration site. So we're going to look at this different drug administration site one by one. Oral administration. Majority of the drugs we use, they administer through the mouth. It can be a pill, it can be a capsule, it can be a tablet, it can be liquid. So when you give a drug through the oral routes, what happens is absorbed from the stomach or intestine. And when it's absorbed from the intestine, it's moved to the hepatic portal system. Hepatic, that means through the renal, then it's moved to the liver. And when it gets to the liver, from there, it moves to the general circulation. Okay, it's absorbed into the blood, it moves to the general circulation, to the brain, to the hands, to every part of the system. So now, when the drug gets to the liver, sometimes the liver breaks down the drug, because the liver is like your, the liver is the engine in your body that breaks down things. So the liver is the main site of drug metabolism and inactivation. It breaks it down, it breaks down drug, it breaks down alcohol, anything chemical is broken down in the liver, and also it's inactivated in that system. Now, when you take a drug through your mouth, there are many factors that will affect it, from the gastrointestinal tract, depending on the nature of drug. You know, your intestine is alkaline, but some part of your intestine is acidic. So lipid solubility of the drug, lipid solubility of the drug means, is this drug soluble lipid wise? Can it move as a lipid? What's the molecular weight? What's the pH of the local environment? What is the surface area of absorbing membrane? The membrane you want to absorb that drug, what's the surface area? What is the gastric empty time? The rate of removal from the gastrointestinal tract by the blood, and the degree of binding of the plasma protein. You know, there's something we call plasma protein, like albumin, they're already in the plasma. moving around. They can bind to the drug. They can also affect the drug distribution. So when we look at sublingual, I've already mentioned it earlier on, is putting it under the tongue or putting it under the buccal cavity. There are some drugs that use that route. Things they use for treating angina attack in the heart, glycerin trinitrate mainly is administered through the sublingual route. Some drug that you also want to have local effect, maybe you want it to have, there's an infection in the sublingual region, or you have an injury in the sublingual, okay, you put it there directly, act directly. You want it, you have a throat infection, somebody have a throat infection, is more rational to give the drug sublingually, so it goes directly to the place you want it to act, instead of going through the GIT and through the renal system. Okay, so the main disadvantage of this route of administration is that most of this drug does not taste nice. The other day I was with somebody that they gave a drug sublingually, and she put it in her mouth and it was tasting bitter. So that's one of the major disadvantages. We have also nasal administration. Mainly if you want a drug to have local effect, you know, nasal decongestant, you can use it for nasal administration. Also, drugs for asthma, you can use it for nasal administration. Okay, so antidiuretic hormone can also be used nasally in the case of diabetes. Another reason why also, there are some specific drugs that you know that when they go through the renal system, they will not succeed. They will be totally destroyed by the renal enzyme or through the stomach acid or digestive enzyme. Some of those drugs, you pass them through the nasal administration if that nasal route is compactable. Topical administration, that talks about, you know, giving the drug on the topical region, so you can write drugs on the skin. Okay, example is antifungal drugs that they apply on the skin. Some other times also, there are also some drugs for what we call dermal patches, okay, for nicotine therapy. You put it on the skin, it will be absorbing gently, okay. Now, other roles of topical administration include application of the drug on the conjunctiva of the eye. You know, there are times people have infection in their eyes, different types of infection, conjunctivitis, the drug is applied directly on the topical region of the eye. So also the external ear, you can administer drug there. The vagina, the urethra, usually to treat local infection. Rectal administration is also another route of administration. That's administering a drug through the rectum region. Usually, the drugs that are administered here is to avoid the impact of stomach acidity. You know, sometimes the acidity in the stomach can impact on this drug. So the drug can be administered through the rectal region. Okay. We also have inhalational administration. That's drugs that are inhaled. Some are for local effect. Local effect means effect at that particular region. Also, it can be from a systemic effect. Okay. We have administration by injection. There are different types of injection. There is subcutaneous. Subcutaneous means under the fat that is under the skin. So you can put it there, it will absorb. It can also be inside the muscle, intramuscular. Usually the injection people get at their bum is intramuscular. It can also be intravenous, directly into the vein. It can be interarterial. It can be interarticular, intraspinal, into the spinal cord, intraepidural, into the epidural region. So there are different ways that drugs are administered via injection. Okay. Now, drugs, if you inject drugs through intravenous, they go rapidly into the bloodstream. Action starts immediately. But the danger of that is if there is any high concentration, there is no way of recalling. It can be disastrous. So that's mainly the disadvantage of intravenous injection. So it is important that an expert will be the one that we administer drug via intravenous injection. Okay, so when you've administered this drug, what happens? The drug need to be absorbed, because any drug that is administered and is not absorbed is a waste. So whatever the route of administration you use, the drug must reach its site of action, because the reason for giving the drug is that it will get the result, the required result at the site of action. So for the drug to do that, it has to cross several membranes before it can reach the blood. Okay, so when we are talking of drug absorption, there are three different types of cell crossing absorption. We have the simple diffusion, we have the facilitated diffusion, and we have the active transport. So what is diffusion? We all know that most drug pass the diffusion method is mainly the method the drug passes through, uses to go. We know diffusion moving from the region of higher concentration to the region of lower concentration through a permeable membrane. So both simple diffusion and facilitated diffusion are passive process. What do we mean by passive process? No extra energy is needed other than the kinetic energy of the molecule themselves. So they don't need ATP or other factors to bring energy to use for them to pass through the membrane. Okay, so there are several factors that are known to influence the diffusion of substance across the cell membrane. So what are those factors? The membrane must be permeable to the substance in question. It is very important. If the membrane is not permeable, that means if the substance cannot pass through the membrane, then it's as good as nothing. Because you need the substance to pass through the membrane, to enter the bloodstream, to be distributed to the required site of action. And when it gets to the site of action, it can now exert the therapeutic target you have in mind. Again, there must be a concentration gradient, because there must be, osmosis, diffusion from region of higher concentration to lower concentration. If the concentration in between the two, now you have a membrane. If the concentration at this side of the membrane and the concentration at the other side of the membrane, opposite side of the membrane, they are equal, then there won't be passage. But if you have a higher concentration and lower concentration, that's a concentration gradient, then the molecule can move from the higher concentration to the lower concentration. The molecular size is also important, and the waves of the substance, it must be small. If not, it cannot pass through the membrane, the tiny pulse of the membrane. A large surface area is also needed for effective diffusion. Then a short distance is necessary for effective diffusion. So let's look at simple diffusion. Okay, let me just, so this is the simple diffusion. Can you see diffusion? Okay, so this is the molecule, and this is the membrane. Then this part is the other side of the membrane. If you notice, there's a concentration gradient. So there is more of the molecule here and less here. So the molecule can pass from this region of higher concentration through this membrane to the region of lower concentration. So this one doesn't need extra energy. All it just needs is the simple kinetic energy of that molecule. So this is called simple diffusion. Okay. So now we talk about molecules that go through simple diffusion. Okay, so you have things like fatty acids, steroids, and fast soluble. Okay, the lipid solubility of the drug depends on the state of ionization. So these are some of the molecules that we go through the simple diffusion. Now, when it comes to the third diffusion, facilitated diffusion, then there is need for there to be an energy. Here, there's a carrier protein for simple diffusion, but facilitated diffusion, we still need, for active diffusion, we need a carrier protein. In simple diffusion, you don't need a carrier protein. It just goes straight. In facilitated diffusion, you need a carrier protein, but you don't need external energy. So the molecule passes through the carrier protein. The carrier protein helps it passes through, it goes into the other side you need it. But when we have active diffusion, then there is need for an enzyme. There is need for an energy, a cellular energy in the form of ATP, adenosine triphosphate. So ATP is required to drive the process and transport that product against the concentration gradients. So by that sort mechanism, you find out that the product can move actively through this body. So many drugs have been developed that interfere with the active transportation of neurotransmitters. So when neurotransmitters are causing problem in the body, when there is excess neurotransmitter that is causing problem, well, you can develop a drug that will reduce the active transportation of that neurotransmitter. So now when the drug has been transmitted, then the next important thing is absorption. We look at absorption from the gastrointestinal tract. Now it has entered your stomach. It must be absorbed into the bloodstream. If it's not absorbed into the bloodstream, then it's useless. Okay. So now the function of the digestive system is to provide nutrients for the body. Okay, but also through this system, drugs also pass through the system to reach the target area. So we've seen this is the digestive system. So you have the mouth, you put the drug through the mouth, it passes through the salivary gland. Now you know the salivary gland, okay, it's acidic in nature. Now, if as it's passing, the drug, the enzymes here are powerful against the drug, they can break it down, it's useless. So when you are formulating a drug, you must take into cognizance that this drug is passing through this saliva. What are the enzymes that are around the saliva, the lipase and co? Can they break this drug molecule? If they can break the drug molecule, then you are risking that drug for not getting to the target site. So what do you do in such a situation? That particular drug that the enzymes here will break down, or the pH of the mouth will destroy, you can put that drug, package it in something where it can escape through this. So it goes through the GIT, through the stomach, absorb, then through the liver, gallbladder. Now, so from the liver, it enters the circulatory systems and is transmitted through the body. Then the breakdown product passes through the colon, through the poo-poo, is poo-pooed out. Okay, so that's the way it works. So now, let's look at drug distribution. Now, only a free drug at this site of action can have a pharmacological effect. If that drug is passing through the mouth, is degraded in the mouth, or is degraded in the GIT, or is degraded in the liver, then it's of no use. Okay, so the drug must be free at the site of action for it to achieve the pharmacological effect that is intended. So when you administer a drug, it does not achieve an equal concentration through the body, okay, except you inject it directly into the bloodstream. So what do I mean by that? When you administer a drug, okay, it may be 50%, 100% of acetaminophen here. As it passes through some enzymes break down some of these, it reduced to 20%, reduced to 10%, like that. Okay, but when you inject directly, 100%. So now the body can be considered to be made up of aqueous and liquid compartments. The body have different compartments. Lipid compartments include all the cell membranes, they have lipid. Adipose tissue, they have lipids. Aqueous compartment includes tissue fluid, cellular fluid, blood plasma, and fluid in places like the CNS, central nervous system, the lymphatic system, the joint, the GIT system. All these are aqueous systems. So we have the aqueous system, we have the aqueous compartment, and we have the lipid compartment. Now, and the drug passes all through this, okay? And now, if you want the drug to achieve its effect, it has to be distributed into different compartments. And there are a lot of factors that can impact on that. So what are the factors that affect drug distribution? Okay, so we have these 7 factors that affect drug distribution. We have the aqueous solubility, we have the blood flow can affect it, plasma protein can affect distribution, lipid solubility can affect the drug distribution, tissue sequestration, metabolism, and excretion, volume distribution. So these are the things that affect drug distribution. So we are going to look at them one on one. Now, we mentioned that there are 2 compartments in the body. We have the aqueous compartment, we have the lipid compartment. So aqueous, from the word aqueous, aquarium, aqua, that is water-like. Then you have lipid, oil-like. So water-like, oil-like. So aqueous solubility affects distribution because water-soluble drugs have difficulty crossing the cell membrane. Why? Because we say that the cell membrane, we have lipid. And you know, lipid and water, and they are not friends. So therefore, they tend to remain in circulation. So consequently, what's the impact of that? Water-soluble drugs are not well distributed throughout the body. So you see them more in the plasma and in tissue fluid, and they are rapidly cleared by the liver or kidney. Why are they more in the plasma or in the tissue fluid? Because we have already mentioned that the plasma and the tissue fluid, the CNS, all those areas are what? They are aqueous compartment. So aqueous soluble drugs or water soluble drugs, that place is more comfortable to them. But the danger is this, that when they get to the liver or kidney, they are rapidly cleared of the system. So in practice, such drugs have very little therapeutic use. So at the end of the day, the therapeutic impact that we desire might not be achieved. Okay. So blood flow. We talked about blood flow as an impact. At equilibrium, drugs are partitioned between plasma protein, and different tissues at equilibrium. So how is this achieved? The rate of distribution of different tissues depends largely on the rate of blood flow through them. So now there are different tissues in the body. The rate at which the drugs are distributed on this tissue, they depend on what is the rate of the blood supply to those tissues. So some areas in the body have good blood supply. For example, your muscles and your skin, they have fantastic muscles, and major organs have good blood supply. So what means is that a lot of drugs will be distributed to that place. Now the skin has moderate supply, and the bone, adipose tissue is the fat tissue. Okay, those ones, they have poor supply. So major organs receive relatively high concentration of the drug when you give them. So, and it can be difficult to get drugs into perfused areas. So the blood flow, the flow of the blood impacts the drug distribution. So in simple terms, areas that have lesser blood flow are likely to have lesser blood drug distributed to them, and vice versa. Plasma protein, oh, this one in pharmacology, this is very important because some drugs have some high plasma protein binding rate. And if you don't understand plasma protein and its impact in drug formulation, you can give a drug and it becomes disastrous for the patients. So inside the blood, in the plasma, there are a large number of proteins that you have the albumin and other plasma protein. And interestingly, a large number of drugs have a high affinity for albumin. So binding to that plasma protein will inhibit distribution outside the blood. Okay, because now when the drug binds to the plasma protein, they're incorporated. So what happened? It's not available to be distributed to the other side. Okay. So plasma protein binding will now reduce active drug concentration and ultimately reduce the response to the drug. Okay, so we know the example of warfarin, those days, and aspirin. Okay, aspirin, warfarin, they have a high plasma protein binding rate, and it has an impact.
Your time is up, from as innocent. Your time is
okay.
up. Yeah.
Okay. Thank you.
So you may give your assignment or ask any questions. So maybe 5 minutes, 7 minutes.
Okay, so let's just take question. Do we have any question? Any question? We've discussed general introduction and course. So do we have any question from any student? Any area you need more clarification? Are you sure they are they muted? Hello? Are the student muted? Can they hear me?
Yes, they can hear you. So if you have any question, just click on your mic, the red mic. It will turn to green, then you can ask your question. So if you have any question, just click on your mic, the red mic. It will turn to green. So you have been unmuted. Just do that. Okay, Aziz Monsurat.
Hello.
Yeah, hello.
Good evening, sir.
Good evening.
What I actually want to ask is that how does this pharmacology um
Hello, I'm hearing you. Hello. Hello, I can't hear you again. The person asking question.
Hello, good evening, sir.
Yeah, good evening.
Hello.
Yeah, I can hear you. Good
Hello,
evening.
good evening, sir.
Yeah.
Hello. Good
Hello,
evening, sir.
good evening. I can hear you. Good
Okay,
evening. Go ahead.
what I want to ask is that good evening, sir. Is it possible for someone to use a pills and the pills is going to work for so it can cure so many things? Is it possible for that? Like
One drug curing so many things.
it can cure three illness.
What kind of illness now? So it depends. What kind of illness? So when you look at the drug molecule, okay?
Hello.
Can you hear me?
Okay, for example.
Can you hear me? Hello?
Yes.
Okay. Yeah, so when you look at a drug molecule, okay, one drug can cure more than one illness, but it depends on the chemical interrelationship. Let's give an example. Okay. A bacteria can cause different kind of infection, okay? So if you use a particular drug, it can attack those bacteria in different area, okay? So, but there must be a chemical interrelationship, but it's not the one these people do in Nigeria, where they say this drug will take care of malaria, take care of diabetes, take care of hypertension, take care of cancer. No, those ones are Babalawo, okay? But there can be interrelationship. Maybe there's an infection happening, one organism causing different types of infection. then if that drug molecule can destroy the organism, then it can destroy those infections. But for a drug to take care of cancer, diabetes, malaria, hypertension, and all those things, no, there's no drug that has that kind of miracle effect across board. Okay. Okay. Any other question? Hello. Okay. I don't think there's any other question, so I think we can call it a day.
Sir, please, what about assignment? Hello.
Yeah, you get the assignment. You will get the assignment.
Okay.
Okay. Thank you.
Okay, thank you. Thank you, Once Innocent. This brings us to the end of today's class. Yeah. Good night, everybody. Bye.
Good night,
Good night.
sir.
Bye.
Good night, sir.
Bye. Yeah. Bye.
Good night.